questions do I have for today? The dosage calc, there are 2 worksheets. One is specific peds and the other one is your med surg, mics per kilo per minute. Examples with answers so you can work on them. I suggest listening to the recording. I did a lot of the questions from it. You're going to see there was a couple of questions I even had wrong because I'm not perfect, and you'll see the correct answers on the recording. So go and look at the recording, fast forward it in between what you need and what you don't need. But there's a little hints that I give that's always been extremely helpful. And after it was done, the students did say, I did make it very simple. I'm not trying to change the style that you use. If you are dimensional analysis, I don't want to change you. I just don't know it. But the way I do math, I'm showing you how to pull. What's a dose? What do you have on hand? What's the quantity? Or what's the time? What formula am I using? What do I need to have? So it does help you in many different ways. So today we're going to be going over infants, toddlers, and preschoolers. And we're going to be going over the theorists within that and developmental steps that you all will need to know. Now, next Tuesday, 5:30, I'm doing the first exam review for exam 1, which is week 4. So I'm doing the first one. Now, there is other 2 professors. I think the next one is Wednesday, Professor Morris, and then I'm not sure Professor Okorafor yet, but we're working on it. I'm just giving you the heads up because of what I know already so far, okay? I am working on the PowerPoint that goes along with it. I'm doing some revisions, some reviews to help you a little more before I hand it out. It should be out by this weekend. I'm hoping to finish it up by Friday. So you'll have it a good time in advance to be able to look over it. And I think that it does have those key things that you need to know. So everybody who's on off camera, could you come on, except if you told me that you're not able to yet. I don't like looking at names. I really don't. If you need to be off for whatever reason, okay, but you know, it's nice to see people. So today, let's start off with the first PowerPoint. You know, I want to discuss something first regarding the discussion questions. You know, I did all the discussion questions, as I've told you, I do read them. I don't just look at them and give a grade. Now, if you scored less than a 20, even a 19, go back and look at the comments I made. In fact, all of you should look because I've given you some information about ADPI to help you take questions apart, to be able to answer it, to look at diagnoses and how to figure them out, you know, and what you need to do. So there's some really helpful information. And, you know, they are for each, it's not just a global for everybody. I've put what you need to know in your comments. So I do take time doing them. So please look at them. So you can give me all 20s next time we have a discussion question, correct? So, all right, let's go to our PowerPoint. Oops, whoops. Well, look at that. We want to start from the back. No, we're not. We'll start from the front. So pediatric nursing, of course, we're learning about kids this semester. And the first thing we're going to learn about is the infants and the family. Now, growth and development in infants, we know they grow quickly. They start out at 7 pounds. By 6 months, they're double it. They're at 14 pounds. By the time, who's not on mute? Could you put yourself on mute? If I can find you. Who's not on mute? Thank you so much. Appreciate it. We know that at 6 months, they should be at 12 pounds, 7 will be 14 pounds. And then at a year, they're tripling it. So they're 21 pounds. So you can imagine how much good nutrition they need to be able to grow. They go from not being able to pick up their head and barely suck, swallow, and breathe to running around and creating havoc in the household. And that's all within the first year of life. So infants have a lot of growth and development. We know that they do lose weight initially, And then they start gaining, it could be up to 10% of their weight they could lose from birth. And then they'll go up to 5 to 7 ounce weight gain per week. And they get big really, really quickly. As they get older, their vital signs change. And that's why I gave you a vital sign sheet. They go from an infant newborn at a heart rate of 140 to 160. And then by a year, they're at 120 already. And it keeps going down and down and down till you become an adult, 60 to 100, right? And the respiratory rate, you know, adults could be 12 to 20. Well, actually 20 is actually getting higher for adults, but infants start at 40 to 60. So you'll see everything. They're able to, you know, their heart beat more efficiently, and their lungs to exchange oxygen more efficiently. And, you know, their body becomes, you know, a really fine-tuned machine. Now, as a baby is born, they're given mom's blood. And that mom's blood is all the iron and hemoglobin and hematocrit that they need. Now, they do not start reproducing their own cells till, about 3 to 6 months, which means as they get older, in a couple of months, their cells are going to die. That's normal what they do. Blood cells do die off. So you're going to see hemoglobin and hematocrit keep going down and down and down. It is not uncommon for an infant at 6 months old to have a hemoglobin hematocrit of 8 and 24. 9 and 27, where it should be 12 and 36, 14 and 52. That's normal because their body's not making it. That's why we need to keep iron in these infants. That's why we give iron fortified formulas. That's why we give supplement vitamins for them, because their hemoglobin hematocrit go low, and that's what carries the iron around. So we need to give that child that energy that needs to be able to suck, swallow, and breathe, and lift their head up and turn over. We know their infants' heads when they're born, they're big, right? They should have the chest bigger than the head, or equal to about a year and a half, 2 years old, when that changes. But we know that there's these soft spots in the front of their head, the back of their head, anterior, posterior. And that's there to give the brain a chance to grow. And we know if it closes too quick or keeps open too long, there's a problem. If it closes too quick, it could squish the brain, okay? If it is open too long, what's there? Hydrocephalus? What's blocking that fontanelle from closing? So this is one thing that we'll be looking at during our assessment, that nice little soft spot. Also, that soft spot as an infant can show us fluid volume status. If it is up and bouncing out, probably something like a meningitis going on because there's inflammation. If it is depressed, that means dehydration. So it's one of those easy things to look at that we can tell without even listening to a heart rate or a blood pressure. The GI system is immature at birth. That's why we do not feed food to these infants for the first 6 months of life. If you feed them food or cereal, sometimes we give for like gastro reflux, you're going to see it in the stool because the body cannot absorb it. It cannot do anything with it. So you'll see it there. So that's why we hold off giving foods, cereals, fruits, and vegetables until 6 months of age. And then, of course, we introduce them extremely slowly. Their immune system is born. They're only born with mom's antibodies. That's all they're born with. And of course, they go away. All right. We know the body accepts us in giving immunizations by 6 to 8 weeks. That's why if you've read the infant chapter and looked at the immunization, that double page of immunizations, you will see 2, 4, 6 months. They're given 4, 5 different immunizations, and then 15, 18 months, we're giving a load more. And it's because we are trying to boost that immune system. We know if a baby 6 weeks and less gets a fever, it's high priority. They have nothing to fight it, nothing. There's the immune system can't fight what's in there. So knowing that is how you work with children and working with infants. When a baby is born, they can't hold their own temperatures. They lose it very quickly. I mean, the head's the biggest one they lose it out of. There's no adipose tissue there. As they get older, they get the pudgy cheeks and they get pudgy, and that holds temperature. But what does that mean for us as a nurse? What that means for us as a nurse is if we have a newborn infant and we're doing an assessment, we need to either keep it covered or we need to have that child under a warmer to keep it warm, simply because the heart rate goes really lower when you have a child who's cold. And I've seen it. I mean, I've worked in the newborn ICU where I look up and I see one of this newborn infants a little bit premature and the heart rate is 100. And I'm like, what's going on? And I go look and the warmer's turned off. They had given a bath. They somehow had turned it off or something, or it got pulled out of the plug. And now this heart rate's going down. And that means that baby's not getting perfused. The gut's not being perfused. And the gut not being perfused can cause a lot of feeding problems in the newborn infant. The renal system, again, is really sensitive. Dehydration is a big deal in infants. It needs to be treated quickly because it can cause kidney damage. So we know that if a diaper, you have 6 to 8 wet diapers per day, we know that this child has enough fluid coming in. That's important to know for that breastfed mom who can't measure like, oh, it's 30 mLs, it's 1.5 ounces. They can't. They just know that their breast feels softer, that they must have gotten something, and that's their sign. But in the hospital, we'll be measuring urine output. And how do we do that? Well, if you have a #1 diaper, put it on a scale, it weighs 30 grams. And if you take a diaper off an infant that's wet and maybe stool in it, and you put it on the scale and it weighs 60 grams, you know 30 grams or 30 mLs of urine came out, and that is output. So it's grams per ml equals the same thing. It's 1 ml of urine output, and we can measure it that way. The central nervous system, oh my God, it's the fastest, quickest thing that's going on. You know, at birth, they have a couple reflexes. You know, they have reflexes, the startle reflex, you know, the Babinski they have, it's normal on them, but they barely can lift their head. They, you know, the nerve system and the muscular system, they can't do anything. But we start giving them good nutrition and you get the myelinization of the nerve cells, which helps with a baby now lifting a head, turning from abdomen to belly, belly to back, getting up on their knees, crawling and creeping and walking. It's amazing how an infant goes from doing nothing, cooing, eating, swallowing, and breathing, up to running around the house within a year. Now, fine motor, think fine, think finger. The other sort of motor development is gross. Think of get up and go. That's the one with turning over and movement and running, okay? So fine is fingers. So the first thing that happens is you give your little baby your finger and they put their hand around it. And you go, oh, he grabbed my hand, isn't that sweet? Well, that's a reflex palmar grasp. It's a reflex that caused that baby to grasp a hold of it. Well, as the baby gets a little older, that baby can grasp a rattle or grasp your hand, and they do it purposefully. They know what they're doing. Then they put it from hand to hand, the rattle or the toy, whatever it is. Then they start with the pincer grasp, and that usually starts when they're ready for the high chair, somewhere about 7 months, and they start with crude, so the whole hand. Think of an infant sitting on a high chair, and you put Cheerios out there, or those little soft puffs they can use now. They'll take a bunch and sort of smush it in their mouth. It gets to the point where they can do a little finger and take them. That's like about 10 months to be able to do the fine pincer grasp. Then they can take things out of containers about 11 months. And by 1 year, they should be able to build a block of 2. That is the forward motion, sequential movement of fine motor skills. Gross motor. They should be having head control by 2 to 3 months. They should be able to go from they're laying on their belly and turn over by 5 months, back to belly by 6 months, sitting unsupported by 8 months, and then going from back to sitting about 10 months. And these are in a forward again, what they should do. Their head, they're rolling. Then they, of course, in between, you know, there's that crawling. They get to sitting, and then they go from prone to sitting. They can get on their hands and knees. That's usually about your 7 months in the crawling, and then walking with assistance should be about 9 months. And by 12 months, they should be able to walk alone. Now, not every child's the same. Not every child's going to walk by 1 year. My 2 children or my grandson, they never walked. At 15 months, all 3 of them ran. There was not a walking moment. But as long as they're going forward in the progression of development, they were okay. Not all children reach the same level all at the same time. Now, psychosocial development and the psychologists, and we're talking about Erickson. Well, you know, Erickson has different things that they discuss for newborns, the infants, the toddlers, the preschoolers, school age, and adults. You need to know these. This will be everywhere. This will be on your NCLEX. They love Erickson, Piaget, and they love Kohlberg. Those things you will see, you're not getting rid of them, so know them. That's why I gave you the handout the first day of class. Now, sense of trust, what does that mean? Well, that means the baby is crying because that's their level of communication. They coo when they're happy and they cry when they need something. So what do they need? Whether it's change their diaper, to be fed, they're tired, or they just want to see you. And you go in and you respond to the infant and meet their needs, they are having a sense of trust. Now, if this child cries and nobody responds on a continual basis, that's mistrust. Because all a baby needs is their needs to be met, their diaper, their food, and their sleep, right? Now, Piaget we use reflexes, and it's primary circular, secondary circular. And what does all that mean? Well, it all has to do about touching things in the mouth. Remember, Piaget, initially, the first phase in the infants is all about mouth. Now be careful. Freud is all oral. Freud says everything in the mouth, chewing, sucking, biting, is all a sense of stress relief. It's a self-soothing thing. That's Freud. Be careful with Piaget. Piaget is the way that they use toys. They can feel them, touch them, what they feel like in the mouth, and move them around. And then, of course, how they can move them is how they can work their hands. Initially, it's just that reflex feel, then maybe stick it in their mouth. 1 to 4 months is they grab it and stick it in their mouth. And by 8 months now, they're whipping around their head and listening to it rattle. So that's the different stages in there. Again, it could be part of imitation. Ever take a little young infant and stick your tongue out at them and see if they stick their tongue back at you? They will. You go, all of a sudden the baby, you'll see the little tongue try to come out and try to do it. It's part of Piaget, primary circular reactions, trying to show you, there's something there. All right, now I know it's there. Body image, they start to know that they have hands and feet. I think it's great when they take the feet and start putting them in their mouths. Right about 6 months, they're on their back, they can roll, and now they're so flexible, and the feet go in their mouth, their hands go in their mouth, or their hands are touching their feet. They start to know what it is. You put them in a mirror, and of course, they're going to beat the mirror up like, who is that? And start giggling at it because now they're communicating with it. Their social development. We know that infants are attached to their primary caregivers. We know that. We know that if you leave them because of daycare, and today, let's face it, it is a 2-parent working environment. You need the parent to be able to put the child in a daycare, but it does cause separation anxiety. And we start, as an infant, we don't see it, but as they get more alert, that 4 to 8 months, when mom leaves, they're going to cry when you put them in daycare. And it just breaks mom's heart all the time, but it's just what has to be done. As they get a little bit older, they start to know, all right, so they realize they're in daycare. They start to know that person. It's not as fearful as it used to be. By 6 months old, they're not going to just go to everybody. There's not usually an infant who will go from a mom to a person. In fact, if they go to a person, you go, wow. They usually don't go to anybody without crying and reaching back for mom. So we know that that's called stranger fear. And we know that they start looking at that stranger, but still not wanting them. Their development and social, well, we know socially, how do we get a response? They cry and they coo. They know when they coo, everybody goes, oh, isn't that so cute? When they cry, somebody goes, because of trust of Erickson, they go grab them. And we know that play is the most important thing for infants and children altogether, that they learn, they become creative, their mind gets thinking, and it's part of that cognitive development that they need. Their temperament, it all depends on their environments. And there is a questionnaire when you concerned. There are some infants that, don't get what they need and they're in mistrust. And we can tell because they don't want to look parents in the eyes or you in the eyes, and they just seem flat affect. We can do a questionnaire to find out what's going on. Now, as I said, first 6 months of life, it's either breast milk or iron fortified formula. That's it, nothing else. They don't need water, they don't need juice, they don't need anything else. They don't need any wasted calories, because sucking, swallowing, and breathing takes a lot of calories. We don't want to overburden them by drinking water. It has no merit in their nutrition. Now, we know that looking at what is normal, what is the weight that's normal on an infant? Well, we know as long as they're going in the right direction, that they're gaining each time that they're being measured. I mean, we see the physician at 2, 4, 6 months, we're getting immunizations. And then of course, in between, if there's any sort of problem, we're going to be seeing somebody, and they always will weigh an infant. And usually they'll take a heights too at visits too, especially the doctor's offices. Now, we know that if they've had enough nutrition, especially that breastfed mother, they'll have 6 to 8 wet diapers. And that's what we need to explain. Many infants that were in the premature that were on, we could measure the breast milk because we had to feed it in a tube or something. We knew what they were taking orally. But once they get home and they're doing, breastfeeding, the parents go, well, I don't know if they've had enough. Well, all you have to tell them, as long as you have 6 to 8 wet diapers, you're doing good. And that will help, or else they're going to want to weigh things like we did. And of course, vitamin D supplementation, extremely important in infants, has to do with muscle growth and joint growth too. Now, the second month of life, we introduce foods. What do they like first? Well, every pediatrician is different. Some like to put cereals in first, some like to put fruits or vegetables. The only thing I could tell you about this is, they're getting bigger, they're growing, mom's been breastfeeding and they need to have food and, getting weaned from the breast. So they don't need as much, milk. Give mom a little bit of a break. They're just sucking all this milk out, and the mother's exhausted from all the breastfeeding. You introduce these solid foods and it takes up space and it gives them, that full belly feel. We do one introduction per every 3 to 5 days. We're not going to give fruits and cereal at the same time for the first time. We're not going to do that until we have said, okay, the cereal, they have no reaction from, and the fruits, whatever it was, no reaction. Now, what would be a reaction? Well, in infants, it might be a dermatitis. It might be some rashes. Could be just under the neck, could be under the arms, in the bends of the arms, could be a horrible diaper rash. Those are things that are telling you the baby is not tolerating that food. So we can stop that food and see if it clears up. And then we know it definitely was that. And then, of course, they're going to say, but try it again to be sure. They do sleep a lot. I think the 2 groups of children that should sleep the most is infants, which they do, but also the adolescents, because of the amount of growth that they grow, the adolescents. And of course, the amount of growth that an infant does grow. They should be sleeping 9 to 11 hours at night. Most children can go you know, most of the way without an in-between meal, but usually breastfeds usually will wake up, and usually they're every 2 to 3 months, because I guess the formula has more vitamins, it's thicker, it stays in them longer, it's more like a full liquid, and breast milk, they consider a clear liquid, believe it or not. And they should be napping in between. They're saying walkers, swings and playpens are not necessary, but let me tell you, swings have been a absolute godsend. You know, when, you know, baby is fussing and you need to do something, you put them in a swing. I wouldn't say you can't, but just make sure that they're put in, strapped in properly. Dental health should be started as soon as that first little tooth comes up. And initially it's just a warm wash rag and washing the tooth, you know, making sure it's clean before they go to bed. Of course, that propping bottles and milk in bed and fruit juices should never be done. They shouldn't be going to bed with food on them, because it can cause a lot of dental caries. I had a son who, this is before they had sippy cups. He's 38 now. And he would take the bottle and just hold it, the nipple in his mouth, and he had apple juice and he'd swing it around all day long. Well, he got those black teeth that they can get, those dental caries. It's just something many years ago they didn't know. I mean, this is how we progress in the medical fields. We learn what we've done, learn from it, and do other things that are better for them. They say how many teeth should be your age in months. So if you're 10 months, minus 6, it should be 4 teeth. Now, many children don't have 4 teeth by the age of 10 months. Again, my children didn't have any teeth till 15 months, and they got 6. You know, remember, it's all different. It doesn't matter as long as they're getting the teeth. Immunizations, these are all the ones. Remember, your Hep B is given at birth, usually in the hospital or the first visit. Why do they give it at the visit, not the hospital? It's usually insurance related. Has nothing to do whether who wants to give it, but these are all the recommended. Remember, in children, just like adults, if you are immunocompromised for any reason, you do not give live virus vaccines. That's the same thing. And this is a whole big list. I think it's a great one. You see 2, 4, 6 months, and then 15, 18 months. Pow, give them all. Trying to boost that immune system as quick as we can. They do fill out reactions for it, and children do get anaphylaxis from immunizations. And of course, with anything adult, children, doesn't matter, you're going to get epinephrine to that child. These vaccines can cause some local swelling, local cellulitis, heat, swelling, hard pain. How do you help prevent that? Well, number one, I tell parents, give your child a dose of Tylenol, like every 6 hours for 24 hours. And then you bicycle those legs up and down so that it can help move that vaccine around. And maybe a warm, just warm washcloth on that area can help that tenderness that they do get. Remember car seats. Car seats are so important. You know, when my children were small, my kids were sent home in a forward-facing car seat. You know, thinking back at it, and this is when they just started car seats. So we know it is back-facing until 2 years old. We shouldn't use any old car seats. We should have new car seats, or very gently used that you know, and then they should be in the proper position, whether forward or for backwards. You know, you go to a yard sale and pick up a car seat. You don't know how old it is. If it was in an accident, you don't know anything, and those should not be used. Colic. Colic is a condition that usually can last up to the first year of a baby's life. And if you've ever had a child with colic, you'll put your hands up and say good luck, because it is the hardest infant to work with. These children cry almost nonstop. They are in constant abdominal pain. They're crying, their legs are jerking, and they hurt. We give them medicines. We give them Milacon, which is a simethicone solution, and it hurts. We put them in swings. We go out for a car ride. We do so many things to try to help them through the colic, but colic is very difficult to work with. So helping a parent how to burp, how to have them sitting up. Every trick that we can give them to help prevent it will be a great thing. And that has to do with how we feed, you know, and how we show them how to burp and make sure they burp well, and then sitting up after eating, et cetera, et cetera. Another problem that can happen is failure to thrive. Well, how would we know if it was failure to thrive? Well, if they're born at 6 pounds and we look at them at 6 months and they're 9 pounds, they should be 12 pounds. That is a big difference on an infant. So what would we do? Well, number one, we are going to find out, well, why isn't this infant, you know, if we're giving the proper amount of foods, et cetera, the proper formula, why aren't they growing? So we'll be doing metabolic screenings, we'll be doing all sorts of reflux, et cetera, care, just to find out, because remember, they're not getting nutrition. Are they growing? Cognitively, they can be delayed due to poor nutrition. So watching a weight on an infant is very important. Some of the other things that can happen is this positional plagiocephaly, which means flat head. You know, today we have the flat head in the back because we believe, because of Sid's death, put a baby on their back to go to sleep. It's the safest that we could do. Now, what do they say for this flat head in the back? Well, infants' heads are very soft. Their bones are softer. They're more flexible. So they say when the baby's awake and alert, put them on their tummy. So give them tummy time. And that gets them off the back of their heads. Dermatitis. Dermatitis could be due to those foods, like I said, or it could be due to the brand of diaper, or it could be the type of, you know, cream you like to put on, you know, that infant. So figuring out what it's due from. I know my children couldn't wear Pampers. You put a pamper on them and they would look like that in 24 hours. My grandson, if you put on Huggies, he did the same thing. So it was, and that was all they were on, breast food and, you know, breast milk and diaper. It was the diaper because it was no creams or anything. So figuring out what it is. Many of the times it's just yeast. And what do we put is nystatin cream on there, and it helps the yeast, and then we just leave it open to air, and we can let that, you know, heal up nicely. And you're going to wash it with warm soap and water. Then we have Cradle Crap. I call it Cradle Crap because it's all crap, you know, crappy and scaly head, and you know, it looks like, you know, you're not taking care of your child, and they're just really crusty. So how do you take care of it? Well, you're going to do the same washing normally, soap and water, yeah, shampoos, whatever it is, but you're going to take a fine comb and softly comb it. And then in time, it's not hard. You're not going to try to scrub it off, just very carefully take care of it. And do you see that little boy in the bottom with a helmet? That's due to severe plagiocephaly, where their heads really don't go straight. And many times it's due to the severe premature, or could be a child who had to be laying on one side of their head for long periods of time. The one thing that I come to mind is if they had a problem at birth and needed to be on ECMO, which is this, they thread tubes in their neck and they can't move. So this side of their head gets really flat. So they do put them on there, and they do help round the head out. I mentioned sudden infant death syndrome, SIDS. There's many different risk factors, males more than females. Having smoke in the house. Breastfeeding helps. Breastfeeding stops SIDS death. Things in the crib, overdressing, heating the child up too much. Those cute little bumper pads that they used to use in the cribs, all those things shouldn't be there. No blanket, no pillows. And the mattress shouldn't be that soft. We want it harder so that this kid can move around. And if they, you know, tend to turn themselves over and get their face inside the mattress, it's not so soft they can't pick their heads up at an earlier age. And then a parent life-threatening event, which is called ALTI, is what we call it. This is when a child, sometimes when they reflux, they will just stop breathing and turn blue, or they will cry and they will stop breathing and turn blue, and it needs to be investigated. They call it a near miss SIDS. and it does need a full sort of, we call it the $1 million workup. They do an EEG and they look at reflux going on, and you know, these children will be going home with an apnea monitor. And that's a picture of the apnea monitor. They're really great. We use them a lot for the premature and for children with respiratory issues that we're concerned about. And it's a Velcro strap that has 2 electrodes on it, and it goes right over the nipple line. And it goes to this monitor, and you set the heart rate and you set the respiratory rate. And when it's lower than it should be or higher, this piercing sound will wake up the dead. It is really loud and piercing. And again, we have all of the theorists, and we're going to go on into preschool, into toddlers. So toddlers, I love this group. This is your 1 to 3-year-olds. I call these the dive bomb kids. These kids have no fear. These kids like to, now they're very mobile. They get up on top of things and they jump. They have no fear of hitting their heads on the floor or running around the house and bopping their heads on the tables. They have no fear. And it's that time, no, 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 mine, 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 me do, me do. Okay, they're very obstinate. Now, when they become toddlers, they've grown like crazy as infants. So ages 1 to 3, their growth really slows down. And we know that their head and chest should be at least equal. And, you know, they grow in spurts now. So you will see a kid start eating a lot, and toddler, which is very unusual because they go into almost physiologic anorexia. They barely eat sometimes. Then all of a sudden they put food in, and what happens? When they start to eat, they're going to grow up tall. And then they stop and they go and they eat less. And then they eat again and they get taller. So that's that step-like growth that they go through. Most of their systems are becoming more mature. They are full of upper respiratory infections. They've got little short ear canals. They've got big adenoids and tonsils in there. And the mucus sits there and goes up into the ears, falls on the trachea and upper respiratories like crazy because of how small everything is in there. At this point, children start to become potty trained. They start with urine and go to stool. We know that way. And they usually start because toddlers are pleasers. They want to please mom and dad. You know, I think this picture, when I saw it, was a riot. You know, I think it looked like grandpa sitting there trying to show the little girl on how to do things. Gross and fine motor treatment. So we know that in their fine motor, they become more coordinated. You know, you see a 1-year-old, the way that they walk, they're still bouncing and almost falling over. By the time they're 3, they're becoming more coordinated. They don't need as much help. We know that both hands start working better between 12 to 15 months. And by 18 months, they can throw a ball, some farther than the other. So be careful. My grandson used to whop me in the head. He thought it was great just to throw a ball to play catch, and he wouldn't tell me before he threw it. When they're born, they look out of each eye separately, okay? They don't look together, so they have no depth perception. As they get to be toddlers, you start to see they're looking through both eyes, but with one vision, okay? And that's where they can be able to see better. They're hearing better, they're smelling, tasting, they're touching. And because they can smell and taste, their food choices get decreased. They don't want to eat the stuff they ate when they were infants. Have you ever eaten or tasted formula or cereal or their fruits and vegetables? Not all of them are very nice, and they're all not really flavorful. So by the time they get to be toddlers, especially by the end of toddler, you're going to see they have preferences. And the biggest ones I always see is chicken nuggets and macaroni and cheese and apple juice is what they like. They don't like fruits. They don't like vegetables. So it's so hard to get, you know, a good diet into these children. So Erickson again, autonomy versus shame and doubt. You know, these are those children who like to try to do things, try to go and get a shirt and put it on, or they're potty training. They like to try to get their pants and try to put them on, and you're going to see them inside out and backwards, and that's okay. It's the trying. So you should never have a toddler tell them, you did that wrong, get over here. Say, no, that's great, but here, let me show you how to do a little better for next time. Wow, I'm so proud of you. That's what should be said to help these toddlers going on. You can have a toddler with all these toys they want, and they can pick out what they want. And we know that toddlers are all about that negative. No, 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 my mind, me, me, me. It's all about that. But what gives these children the most comfort, makes them feel, safe, is these routines, rituals. They wake up, they know they're going to put their clothes on, or they wake up, they have breakfast, and then they're going to take a bath, or they're going to go play outside. It's the same thing every day. And when they're on that routine, they do well. Toddlers do not travel well because their routines are changed. And that's why you'll have a hard time with a younger toddler when you go on vacation. Preschoolers are different. They tolerate it. They're in that sensor-motor pre-operational phases. And what that means is they're still exploring with play, the touch, the mouth, the feel, the movement, those things. Primary circular things, when they find out that they like to suck their finger and it gives them pleasure, they're going to continue doing that. Or they find out they do something and it makes them feel good, they're going to continue doing that. This tertiary circular, I think this is the best. This is about 12 to 18 months. Mom goes in the kitchen to do something or walks away. Let's say go to the bathroom and they're sitting there in their high chair and they don't want to be alone. You'll see them take their juice cup and slam it on the floor, their cup and throw it on the floor, because they know mom's going to come back and find it, whether it's a good or bad response, but mom's coming back. And that's just really all that they want. They're into body image now by the end of the toddler age. They're starting to understand where their ears, their nose, their mouth, their belly buttons are, and they like to show you all about those things. They're starting to learn more words to be able to describe their needs and wants. And they're understanding there's boys and girls. I think the most time is when you have the little boy who walks into, like me, Nana, go in the bathroom and they're looking and it's like, he looks at himself and looks at me and I'm like, yes, we're different, and you say, I'm a girl and you're a boy. As they get older, you'll tell them, and it should be in the words, the proper words, you have a penis and I have a vagina, we're different. And that's all that needs to be said. Now, they start checking out their genitalia very early. They're going to touch it, feel it, because it's there. It's like, what's going on there? Again, they know boy and girl, like I said, they know mommy and daddy, and they'll play things like house. They know the difference between peoples now. They know that there's mommy, daddy, Nana, pop, your uncle, whoever it is, they know who everybody is now. And they all know things that gives them that comfort, that makes them that individual. It could be a little boy taking and building up a racetrack and racing a racetrack. Could be girls setting up a little house with their dolls and with toys, all of these things. And we know that when they're separated from parents, we know that if we give them something, gives them comfort, whether it's a toy or a blanket, that's what we need to do. Their language really improves. It gets really broadened, and that they're understanding more and more and more. They want to feed themselves, and you'll see that 15-month-old try to take a spoon and feed it, and it's upside down and backwards. It's okay, leave them alone. The attempt was there. It wasn't that it was done correctly, and they're going to make a mess. That's just what it is. It's what they do. They like to get their clothes off or put them on, and, just helping them get through it and giving them praise for it. And they're going to start to understand feelings of others. You know, at times, I have rheumatoid arthritis, and my grandson lived with me for the first 3 years of life. And I would have times where I'd have an ice pack on an arm or a wrist or a foot, whatever. And my grandson would come over and give my leg or whatever a hug or a kiss and say, all better. They do have feelings. They do have concerns, you know, and I think it's special to have that toddler who does things like that. Play, 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 important. Knowing the types of play and what they mean are important. This is the things that grow your child and makes them who they are. It keeps them with it's interaction between people, and it's learning how to cooperate with another child, whether it's just sharing things or cooperative play, playing a game that has an ending like Chutes and Ladder or one of those. Toilet training is between 19 to 24 months. Doesn't mean at 24 months everyone is potty trained, because remember, every child has their own time schedule, but that's the textbook version. We know that there is some rivalry between your siblings. If you have a younger child born, the older one is going to have a little bit of jealousy. So getting them involved in the care of the little one can help. We know toddlers are temper tantrum times, and they don't really like bedtime. So there should be some sort of bedtime routine, like reading a book to them, or, you know, doing coloring, or whatever your routine is with them. Again, no, me do, mine. And when they get upset, when something happens in their life they don't like, you will see them regress. Let's say mommy and daddy had to go out of town, and you know, they had to be put with a friend, and you're going to see that child all of a sudden needs a diaper, he's having accidents where he didn't need it, or he wants a pacifier he hasn't had. All of those things are part of regression, and what that does, it helps them self-soothe and relieve the stress. As I said, that was my grandson, my firstborn son. His first teeth got black, not that severe, but they were pretty black. As I said, nutrition during toddlerhood, they're minimal eaters. They don't eat as much, they don't gain as weight as much. And again, it goes step ladder. They eat, they get taller, bigger, and then they plateau. And it's all like that through 1 to age 3. As I said, they barely eat. I know I come home from work and my husband would be watching my little grandson, Christian, and he'd say he's only had a little piece of cheese and half a banana, and he needs to eat. You need to feed him. And I'm like, yeah, that's okay. He had fruit and he had
Recording in progress.
It's okay. So this is physiologic anorexia, and it is normal for them to eat this little. This way, sometimes we will, as long as their weight is going in the right direction, and it still will, you know, with this very slowly, but it's okay. Sleep is not as much as your infants, but it's still quite a bit. We know that they should be brushing their teeth, very important. They should be flossing even at this age with mommy helping. And again, we're introducing lots of foods. We're introducing, you know, different clothes that they wear. Atopic dermatitis could be due to all those things, so paying attention. Safety promotion, huge. Injury prevention, huge. These children, I said, they're dive bomb kids. There's no filter. They just don't understand. And they're going to be intense exploration around the house. We know motor vehicle safety is in any level of child, infant to adolescent. So of course, putting them in the proper car seat. Pools should have a safety net around them. You know, I was blessed that I taught my grandson to swim underwater and do front flips off the diving board by the age of 2. But he will not go near the pool until he asks permission first. He did it one time. He got pulled out of the pool, went on time out. He screamed and cried. He never did it again, because then we explained, you could have gotten hurt. You could have drowned and died if you do that again. I want to just be able to watch you. We're telling you no, you need to tell us. You need to ask permission. And he does up to this date. And he's now turned 5 last Sunday. Burns are huge, pulling things off the stove. And of course, we have mosquitoes and bees and all whatnot. And of course, these children, they're sweet and they love to be bit. These children should have a poison control number at their house. It's something that you should be giving your parents so they can call. It's the most up-to-date information on how to take care of whatever it is. Children, of course, they eat everything. One of the things they eat the most is their vitamins. Even their Tylenol or Motrin is things they love to eat. So poison control number is big. Lead poisoning is when you have older houses, New York City apartment buildings that they chewing on the windowsills, which kids do, you know, lead poisoning. And of course, then we need management. And, you know, there is that chelation therapy that can be done to help them. And the last section is the preschooler, ages 3, 4, and 5. So here we go. At this point, again, just like toddlers, they're growing very slowly. 5 pounds a year max that they'll be growing. And now their body systems are maturing, they're stabilizing. Their immune systems are stronger because they've been exposed to so many things. And these children can handle a little bit of stress and change. They're not as temperamental as your toddlers. As you get older, explain things, these children tolerate stress a lot better. Gross motor, get up and go. It's not fine, okay? Gross motor, get up and go. Now they're walking, running, climbing, jumping, and it's more coordinated. It's not so walk a little bit and fall over. No, now they're able to do many things. Fine motor, by the age of 4, they should be able to do a button on a shirt. They should be able to dress themselves. Again, probably it's going to be by ages of 4, not the 3-ish area. They should be able to put on clothes correctly. And again, if they don't, just show them how to do it. And these children are really much, they want to please you. Now, these children know right and wrong. There we go, the sense of initiative. They like to do things to please you. They know that if they do something wrong, there's gonna be, they're gonna feel guilty about it. And they're gonna be fearful of that. It's a little different than Kohlberg, okay? Kohlberg says they know good and bad, and there's consequences for each. You get a good consequence for good and a bad for bad. Now, Erickson's a little bit different. It's just that they're starting to learn what they can do right to get praise and what they do wrong that they're going to get a punishment, okay? A little bit different. Piaget is now, they're starting to understand the people around them. It's not just so me, like Toddler. We're starting to be able to share with other people and understand what other people want to do. Their talking, their communication, their language is amazing. Now, they still don't understand 5 o'clock in the afternoon. What they understand is after you take your afternoon nap, we're going to get up and go to Nana's house. Or when you wake up in the morning and the sun is shining, we're going to go for a car ride. Or after you eat your lunch, we're going to do this. They do not know time yet. And this is that stage where you can see the magic going on in these children's head. You're going to see them take toys and sit there by themselves and play and swoop them around and, you know, think and talk about what they're doing. They're telling this truck is coming here, and you just see this creativity going through and this imagination, and they call that magical thinking. Magical is preschool. Again, Kohlberg, like I said, punishment and obedience orientation. So they know if they do something good will happen to them, or just a praise. If they do something bad, they know they're going to get in trouble. They still are working with their body image, but now they want to get dressed and they want to look cool when they dress. They want to have those flashy little tennis shoes that make lights when you run around. They want to have the pockets in my little grandson, pockets in his shorts and little shirt, he just thinks he's the coolest thing because he's got buckets, or he's got a collar shirt with buttons and he just thinks he's just the coolest kid. So it's understanding being that desirable appearance. They know that there's difference in races now. They're starting to see differences. They don't care the differences, but they're seeing. They know that kids have freckles and some don't. Some have curly hair and not, blonde hair, brown hair. They're starting to see that there's difference. The boys like the mothers better and the girls like the fathers better. This is just part of, what is. I mean, I know to the day that my father died, I was his favorite. I was his only girl. I had 6 boys, 6 brothers in the house. So it's something that lives forever. They're starting to kick you out of the bathroom when they're going pee-pee, poopy in the potty, because now they're modest. They don't want you to look at you. They really are starting to explore themselves, and they're starting to talk. They're starting to, do that masturbation and feeling what those things are. And they might ask you, oh, how did you get the baby in your belly? And you say, Dad put it there, and you don't have to answer anything more. They're starting, this separation, individual. They don't have that separation anxiety as they used to be, or that stranger problem. They're easier to go into situations, with that explanation. Of course, if this child, let's say this 4-year-old, 5-year-old, need to go in a hospital, having something that was their own with them does comfort them, whether they're pajamas or maybe their pillow or maybe that blanket that they like to sleep with, et cetera, et cetera. Those things are important, and something as nurses we should know, because if mom or dad has to leave and you're alone and the kid's crying and the blanket was on the floor, you know that, oh, look, here's your blanket, let me give it to you, and help them go back to sleep. Their language is again more sophisticated, and they can talk words that you never thought they could. They don't need that ritual that they do need for toddlers. They are a little bit better. They also can dress themselves, and you see this little kid, fine motor, he is putting on the buttons on his shirt. Again, they're trying to please. They love to please. Can you help mommy do this? Help Nana do this? And they do want to help you. And they do challenge things, like if they don't want to go to bed, they're going to challenge you. Or if they want to have extra juice at dinner, they're going to challenge you when you say no. And it's just part of them trying to push, as my mom used to say, push the limits. Again, associative, imitative, imaginative play, mutual play, so important, whether it's together or you're imitating another play or just sitting there imagining by yourself or playing together with the same toys with another child or more. Sex education, finding out, what does the kid know? What is their ideas? Again, using the proper words, that there's a penis and there's a vagina. I mean, it's just a normal thing. I mean, everybody has their own thing they say. My grandson knows a penis and a vagina. And I said, why are you touching your penis? It itches. Okay, fine. Masturbation, very important. And why is this important that I'm telling you about that? Well, children usually have a toy of something with them. You can walk into a room, they're either in a hospital or an emergency room or a doctor's office, and they could be sort of rubbing themselves with a toy, and literally they're masturbating. Now, some parents will say, oh, stop that, that's nasty. Well, it's normal. So as a nurse, what am I going to do? I'm just going to say, I need to do something, I'll be right back. Give them that moment to do what they need to do. They're starting to have fears. They don't like dark. They want the lights on. They don't want to be alone. They don't like some animals. Little yappy little dogs drives my grandson nuts, but a cat doesn't bother him. So, it's just part of that fear. He's afraid of ghosts. And I'm like, have you seen a ghost in Nana's house yet? When you do, let me know so I can go say hello. And then, of course, they're afraid of annihilation. When you have a preschooler, they cut themselves and bleeding is coming out. They think their whole blood system is going to go away. So have a lot of Band-Aids in the house. Okay, this is the age of a Band-Aid fixes a boo-boo. You sometimes can have a speech problem between the ages of 2 and 4. So early intervention, given speech therapy, can help a child get caught up very, very quickly. And again, I'll tell you something with speech problems. If you're having a child problem with speech, get their hearing checked first before you go through that, because it could be hearing and they don't know the pronunciation of this. And as soon as you can get it checked, as soon as you can do early intervention, the quicker the child's going to turn around and be just like everyone else. Nutrition, again, we know that they're going to eat. They're not going to eat everything you want. It's still not going to be a large diet, but having them eat enough of the proper food groups is good. And another thing to be aware of, there are some children who love to eat. It's the way that oral, right? Food in the mouth, that it does give them comfort. So be careful, because obesity does start young. So we don't want to have that as they grow up to be adults with the problem of obesity. You should get about 12-hour naps. You're lucky if you can get them down for a nap at this. They can wake up during the night, and this is the age of night fears on these children. Again, that consistent nighttime ritual calms them down, knows they have that one-to-one time with mom or dad, and it does help a child get put to sleep. These children should not be just in the TV, in their iPads, doing whatever. They need to get up and get out and run around, ride their bike. Putting them in sports is very important. Letting them play with other children is great. Another thing that you can see in children is abuse. Now, I've seen abuse in many different manners, and it's not easy. Probably for me, of everything, it's the hardest thing to watch. You have a normal, healthy child that comes in, and I worked emergency room the last 10 years of my career. So this is where I saw these things. And the hardest thing is not wanting to beat the parent up. You just want to say, what were you thinking? But you can't do that. Your job is to protect that child now. So I'm going to give you an example of one, and it's not pretty. So a 3-month-old came in the emergency room in mother's arms and complaining of this swelling, this yellow purplish behind the ear, and needed it checked. So the first thing I do is weigh the kid, right? If I have to give meds, I have to have a accurate weight. Put my hand underneath the kid's head and I feel it smush in. And the kid cried. I'm like, oh my goodness. Did the weight, gave it back to mom, did my full assessment, put her in an area in the emergency room for the infants, went directly into the chief doctor and to the charge nurse. And I said, this child, I believe, is abused. I think there's a fractured skull. So the doctor said, go do an x-ray of the head and do a x-ray that they call them bodygrams, the whole body. Let me tell you what we found. A fractured skull, a fractured humerus, fractured ribs, fractured femur, a 3-month-old. Okay. What did I want to do? Okay, I didn't do that. So the charge nurse, okay, I ended up, because I was so concerned, out of triage, took the child over to x-ray myself to get it done expeditiously. I want it done now. I want to make sure this child is safe, because saving the child is your first priority. So we did call in all of the appropriate authorities, police, et cetera, et cetera. People wanted to punch the mother. And I'm like, you can't, you don't know who did this. Well, after they got the sergeant in of the child abuse squad, et cetera, and multiple questions, and the kid was admitted to keep it safe until we figured out who it was. I think it was 3 days later, the father finally said, yeah, I did it. What happened was mom had to go back to work and was working like 3 or 4 jobs because the father lost his job. So the father had to take care of these twins and another 2-year-old in the house. And the kid wouldn't stop crying. So he was in the tub and he picked up the kid and smashed it on the surround over the tub. Yeah, it's pretty sick. I told you, it's not fun. But those kids were safe because the father went where he needed to go. So the mother, could take care of these children. And I honestly don't believe the mother knew, because she came to the emergency room for help. She brought her child in there because she saw something wrong. And I'm telling you, all 3 kids had the same thing, same injuries. the other twin, and the 2-year-old. So it was, to this day, I'll remember it forever. They'll always be in my heart. And thank God that they did get away, I hope, forever from that sort of abuse. And there's also the sexual abuse too, and finding out who it is. Is it the cousin? Is it the next door neighbor? Is it the uncle? You know, and that's when we use play and dolls and finding out what went on. And that's done with the psychologist and child life and, you know, figuring out who it was. Neglect could be many different things, but it is described as deprivation of food, clothing, shelter, supervision, medical care, and education. So it could be any of those things. And, you know, sometimes it's because of lack of money, you can't do things, but neglect does happen. And it could be the emotional too, or it could be, you know, that physical neglect with not getting what they need. So, ready for some Kahoot? It was a horrible story, wasn't it? Yeah, I agree with you. But I'm warning you, if you ever want to work peds, it can happen. And you'll remember me saying, I just need to keep this kid safe. Keep the kid safe. Who wants to win a Kahoots today? LaShawn, you're going to win today? Yeah, okay. Tanya, you want to win today?
I'll try.
There you go. There are 55 questions on this Kahoots. What I am doing is I'm posting to a YouTube channel, and I will be sending that to you. It seems to be working better than just sending you links. Along with that, in the YouTube channel, there's information, and I'm putting the Kahoots there, but I'm sending you everything. I'm sending you the cloud recording and the YouTube channel and the Kahoots link. So you have everything you need to look these things up. Is that an octopus? Yeah, it's got 8 arms. Yes, it is. No, I don't score the Kahoots. The Kahoots is here is just for you all. So don't be concerned if you're getting questions wrong that I'm, you know, checking something off. No, these Kahoots are here for you for the repetition of learning. So let's just get going. Week 2, infant, toddler, and preschoolers. A lot of growth and information material here. Which factors predispose toddlers to frequent infections like ear infections, tonsillitis, and upper respiratory infections? So because they have tiny little eustachian tubes that are straight, open, big adenoids, it holds mucus there. So it goes up into the ears and drips on the trachea. So that's why you have a lot of infections on these children, especially those upper respiratory and those noses. According to Kohlberg's pre-conventional level of moral development, a preschooler who has moral reasoning does what? So remember, Kohlberg talks about preschoolers understanding good and understanding bad, and each one has a consequence for it, a good consequence or a bad consequence. Mackenzie knew that one. Infants ages 0 to 18 months receive pleasure from biting, eating, chewing, and sucking, according to who? It's not touch, it's not just, or it's only oral. It's not touch or motion. That's the difference between Piaget and Freud. Freud is all about oral, everything in the mouth. Piaget talks about the touch and the texture, and then in the mouth, and then the motion of it. And that knew that one. Somebody's on fire there. Which nursing action is appropriate to teach a preschool child about scheduled procedures? So you need to go have a child have a CAT scan of their head. They need to lay there for, 2 minutes. How are you going to show that child so that they're not going to be stressed? They're going to lay there and do what you need them to do. And you're going to give them a doll. Giving them a doll, sometimes if you need to, showing them a machine, showing that we're going to put, straps on them so they don't fall off the CAT scan stretcher, etc. And they're not going to be afraid. Children, when they know, do so much better. Multi-select. What are some findings from a pediatric physical assessment? Physical is what you can touch or listen or see. Physical. So physically, you can know the growth, height, and weight. That's physical. You can listen to the body systems, the respiratory system, look at the eyes, etc. But the history, review of symptoms, are more of your assessment. Your nursing assessment has nothing to do with physical, okay? There's a difference there. Mackenzie came back up. Before performing a physical assessment on a toddler, the nurse should do what to encourage cooperation? So absolutely, let them use play and let them touch it. Now, the one thing I'll tell you about the younger children, never walk in and think you're just going to explain and do something. You need to go in, sit down with them and break the ice, whether it's telling them they've got a pretty shirt on, they've got cute, their eyes are gorgeous, or their shoes are sparkly, or how you doing in school, something. Break the ice, then say, okay, we need to do this. Let me show you what it is. Here's a blood pressure cuff. Would you like me to do first? You need to push the button. You need to help me. Doing those things will save you hours of time, because children do not like somebody they don't know, a stranger, touching them. So don't think you can walk right in and do something. Ain't going to happen. What would you suspect if you note that an infant's chin is quivering, their fists are clenched, and they're inconsolable? And I think that unconsolable thing is the biggest word there to look at. That's pain. You see that little chin, and then the fist clenched, and you usually will see the legs going, but the unconsolable. Usually children that are hungry or diaper change, you pick them up, they're okay. But in pain, no matter what you do, they're not going to be consoled. And we use the FLAC scales for infants, right? Faces, legs. You need to do an assessment on an infant. You walk into the room and the infant's asleep in the mother's arms. What are you going to do? So you have an infant who's quiet, who's sleeping. I'm going to assess that respiratory status because that's the best way to do it. I can listen to breast sounds. I can listen to heart sounds because the child's quiet. Most infants, when you wake them up, they're going to be making noises and cooing and you can't hear as well. So it's perfect. I can see retractions or I can see nasal flaring in infants. It's severe respiratory distress. So looking at their respiratory status, absolutely, and then listening to their chest, etc. By what age should an infant be able to pull themselves up into a standing position? Just like that little baby there. And that should be about 9 months. 6 months, you should be able to roll from front to back, back to front. 12 months, you should be able to walk. And then 15 months, you should be able to run. But 9 months is when you should be able to go up on that couch or the coffee table and move around by them with help from something. When do you switch formula to whole milk? We know that they are on breastfeed or they're on iron fortified formula for the first 6 months of life. When they get to 1 year old, changes go on. They've gained a whole bunch of weight. They're toddlers now, physiologic sort of anorexia. They don't need as much food. You don't want the formula to take up the space of food now. So whole milk is at 1 year, absolutely. I had a question, why isn't it skim milk? Well, we still need the nutrition and toddlers are barely eating, so they need that extra fat and calories from it. Now, if they're overweight, of course, we're going to put them on, 2% or something. Before assessing a 4-year-old child, what techniques would you use to approach this child? Perfect. You sit down with them, you talk about their shirt, their school, their shoes, their freckles, their eyes, whatever. Break the technique, and then you can talk about, let me listen to, you want to listen to me first. Here's the equipment. What technique can be used to examine a toddler? Toddler, ages 1 to 3. So you are going to use play and you're going to assess the body parts, and you could be listening to the lungs or, look into the ears when they know where things are. There is no head to toe. You can do what you can do when you can do it with a child. Like the infant, it was asleep. We did the chest and listened to lungs first. And later on, we're going to see, how alert they are or their pupils are. So there is no directional anything on how to do an assessment on any of these children. When assessing a healthy child's lymph nodes, what should you expect? Healthy child. You shouldn't be able to feel anything. If the kid's not sick, there should be nothing, feel nothing. When they swell up, there's an infection, something's going on. When walking into an exam room, you see a 2-year-old rubbing a stuffed animal on their pubic area. What do? And yeah, we're just going to say, okay, I need to do something. I'll be right back. Continue it. Bring no attention to it. Absolutely normal part of growing up, that exploration. Mackenzie's up top. A parent of an 18-month-old boy says that he says no, no, no to everything and has rapid mood swings. Is that normal for an 18-month-old, a toddler? And it's absolutely normal. That's what toddlers do. What is descriptive of preschoolers' understanding of time? Preschooler, ages 3 to 5. Do they know time? So they associate time with events. They do understand time. They know after lunch they're doing something and they know they have to wait. It's still understanding time, but it's with events, not the numbers on a clock. Multi-select. How do you place a toddler on timeout? I love the face of this little girl. So it's 1 minute per year. Explain why you bit your brother. And while you're on time out, you need to be quiet and stop crying, and we'll start the time then. And it's 1 minute per age. A 1-month-old infant's back of their head is flat. What would you tell the mother? She's concerned. My kid got a flat head. So you're going to put them on their tummy when they're awake. We're going to do tummy time. You know, years ago, to prevent SIDS, they said either the back or the side. And what they found in side lying, that the child could rebreathe the carbon dioxide that they were exhaling. And that could cause SIDS death too. And that's why it's now only on the back. It's been that evolution of preventing SIDS. Infants crawl before they walk. This pattern of growth and development is called what? And it has to do with the sequence. So it's sequential trends. They go through a normal sequence. They go from their head being lifted, and then they're able to go from rolling from their belly to their back, and they go forward that way. It's a sequence. So it's sequential trends. What is a risk factor for physical or developmental delays for an infant? So prematurity, being born, too early, has so many concerns that can happen. They could bleed in their brain, and they're not getting proper nutrition for time, and hypoxic episodes, etc. All of those things are risk factors. Premature infants. How do you communicate with parents that do not speak a language that you know? So we're definitely going to use that telephone interpreter because people who came with them are going to put their own opinion on what the parent says. So doing it through an interpreter is the most accurate way of getting what they're trying to tell you. What age would most children understand under, on top of, beside, over, and back of, around, beneath? And that's about 4 years of age. I know many children do it by age of 3, but book, 4 years of age. I know my grandson was just about 3 when he understood those things. In terms of language and cognitive development, a 4-year-old child should be expected to do what? So a 4-year-old child should be able to follow simple commands like go put your dirty clothes in the hamper, take your shoes, put them where they belong. All right, get in the bath. It's time for your bath. Put your dirty dishes in the sink. They should be able to do those things. The first expected fine motor development milestone for an infant begins with, remember, F, fine fingers. So the first thing is the reflex palmar grasp, which means mommy puts that finger in, into her hand and the baby grasps it and they go, oh, my baby grasped my finger. It's a reflex and then it becomes voluntary. So reflex is first, then voluntary. Mackenzie knew that, is on fire. Which statement about toilet training is correct? So we know that bladder is before bowel, but because they want to please the parent is why the child becomes toilet trained in the first place, okay? They're pleasers, absolute pleasers, toddlers are. A toddler's parent asks the nurse for suggestions on dealing with those temper tantrums. Kids screaming, yelling, throwing themselves on the floor in the middle of the grocery store. What do you do? Isn't that embarrassing? Walk away unless it's something that could injure them. Say, okay, when you're done, I'm going around the corner. See ya. And they usually stop and they'll just come and follow you, as long as they're not going to have an injury from what they're doing. Leland's on fire now. The leading cause of death during the toddler period is what? So it's injuries. And then when we think of injuries, we know the biggest injuries on all levels of children is motor vehicles. So injuries. Remember, toddlers are dive bomb kids. They don't care. They're diving off of something, running around and hitting their head on the table, etc. It's just they have no filter for injury. A 2-year-old has difficulty in activity, sensory sensitivity, and only speaks one-word responses. How do you assess that? So when you talk about sensory sensitivity and delayed one-word responses is not normal for a 2-year-old. So assessing that, you sort of think because of sensory autism. So this is actually the modified checklist for autism. We're going to go in that more as we get into those things and talking about it. But autistic children don't like light, don't like sound. They don't like to be in crowded places, and they do not want to be touched. And they're usually cognitively delayed. So how do you assess that, and what needs are they needing? You do that modified checklist for autistic toddlers. There's checklists for everything in nursing, trust me. Parents are concerned their 8-month-old child's not developing like their older child. What is normal for an 8-month-old? So sitting alone, unsupported, 8 months old is what they should be able to do. When you talk about pulling themselves up to a sitting position, that could be like 7 months old. First steps, about 12 months, and blocks in a container, about 11 months. What motor skill is expected of a 4-year-old child? And that's the buttoning shirt, the 4-year-old. Now skipping, that's a little bit later. Tying shoes is about 6 years old. Walking upstairs, alternate feet, that also is a little bit earlier. So buttoning a shirt is what they should be able to do at 4. Unless they're these tiny itsy bitsy little buttons that even I can't button. Car seats can be safely switched to the forward facing position. At what age? You know, I had a really hard time with this because my grandson was always a peanut and didn't weigh enough that I thought for the age that they should. But in the end, the age took over and he did well. It has to do with motor skills. And it's 2 years old. They should be able to take the back facing to the forward facing safely because it has to do with their motor abilities. At 2 years old, they're more capable to sit in a forward facing position.
Isn't that by weight though?
They do have the weight. I believe it's 30 or 32 pounds.
So why would you say just a 2-year-old? Because some 2-year-olds, I don't know.
Yeah, my 2-year-old grandson was 24 pounds.
Right. So
and we did ask the pediatrician and they said, nope, he's 2. It's the motor, his level of ability to control his body is why there can be forward facing. Because yeah, I went through the same turmoil, but that was the question and to the answer to it. Yeah, I agree with you. I'm with you. The second expected fine motor developmental milestone for an infant begins with what? So the first one is the involuntary or reflex, then voluntary. Good job. RN doing a developmental screening on a 10-month-old should expect which fine motor skills from them? 10 months old, fine motors, fingers, what should they be able to do? So by 10 months, they should be able to get that grasp and they should be able to use the pincer grasp. So we know that it's the voluntary should be able to be done. Pincer grasp is probably cruder at this point, but they should be able to do those 2 things. It's really hard in growth and development picking which one because they're so close together. Frequent developmental assessments are important for which reason? So we know that if we're doing developmental assessments and they're staying at one place and they're not moving forward, there's something going on, and it identifies delays or deficits. And why do we want to know these things? And why do we do all these developmental assessments? It's because the earlier we institute early intervention, the better the child can catch up to the normal sequence of where they should be. A multi-select. An infant searches for her toy that is not in sight. What is this called? It is called object permanence. That's the first thing we think of. That is memory development. They knew that they put it somewhere, just like the boy that we took the toy and we put it in the toy box and put it away for the night. And the kid goes back to the toy box and grabs it. And that has also to do with exploration, that we don't need mom, dad, or anybody to give it to them. We know how to find it now. That's what that's all about. The natural physical developmental sequence that most children follow is what? So we know head is first. So that should have been your clue. Head up, roll over, front to back to front, creep, crawl, cruise, and walk by the age of 12 months old. Good. Which observation leads the nurse to be concerned about an infant's mental health? So again, if you have a child, an infant has like that mistrust, right? I've talked about it earlier. You have that child who doesn't get their needs met. So they're in that mistrust stage of Erickson. They're not going to look at you, and they're going to be like, looking somewhere else and just not interested in what's happening around them. And that does tell you about an infant's mental health. You think, how do we know? It's just the way they respond. They're not acting normally. Which would alert the nurse to hold the digoxin on an infant she is caring for? And there's actually two answers. But you only can put one. I mean, the first thing I'm going to do is I'm going to be checking the heart rate on any patient I'm giving digoxin for. And there's parameters you look at. Now, we know that an infant, if it's less than 100 or 120, something's wrong. So that's the first thing I look for. And then I would look for the digoxin level. I mean, the better answer is the heart rate, but yes, digoxin level 3.5, absolutely too high. Get the digibind ready because we're giving it on that child quick. In general, an infant should triple their birth weight about what months of age? And it should be 12 months. Remember, doubles at 6 months, triples at 12 months. Okay, very important to remember that. We can say if they're too big in obesity or if they're too little, and that's failure to thrive. We need to do something. When an infant's toes spread when the soles of the feet are stroked, this is called what? Just like that little picture there. and that is Babinski. Rooting is when you take the side of their chin and you stroke it and they go looking for the breast or the bottle. That helps, an infant look for food. Startle is when you make a loud noise, just like Moro, same thing. Make a loud noise and their hands sway and their feet come up. And we know the grasping, whether it's voluntary or involuntary already. So those are your reflexes in infants that you need to know. A 4-year-old is reluctant to take medicine. What intervention should the nurse take? I mean, not every child's going to want to take their medicine for whatever reason. I mean, we know that there's ways to force medicine down a child, but it's really not the best because you're going to send this child home and the parent's not going to be able to do it. So you never ever mix food with medicine, with food or juice. You don't know how much they took, okay? Especially never in a bottle. Sometimes a little bit of, fruit, something that they can do it with. You don't walk away, you don't come back. Usually if they're reluctant to take medicine with you, they're not going to take it with a parent. So walk in, sit down, say, I need to give you medicine. Now, would you like to give it with a spoon, or do you want a syringe to squirt it, or do you want a cup? Tell me what you want. And just make it, these are your choices. It's not a choice not to take it. And most children will respond to that when they're given that choice. Immunizations for a 4-month-old. Which action should the nurse take to provide traumatic care? So again, any infant getting anything, labs drawn, catheterization, put a pacifier in, little sugar water, and this child will relax and it will provide the least amount of pain for this child. And that is our goal today, to prevent pain at all costs. According to Piaget, infant development in the blank stage occurs in 6 subsets. Infant development. You think infant, think sensorimotor. Yes, very good. That was a tricky question, but reading the question now, you got the answer. What are the common illnesses in the toddler age? Remember, everything is in the mouth. They share, swapping spit constantly, and it's the ears and it's the respiratory tonsillitis. Yes, yes, yes. Which intervention helps a hospitalized toddler feel a sense of control? Remember, toddlers, what do they like? Remember, toddlers like ritualizations. They like the same routines. Why not? In the hospital, can't you do the same routines? Yes, you can. So make sure that you know what they are so that you can help the parents do that. Keep the child calm, and you rather have a calm child than one that's going nuts. And are in assessing a 2.5-year-old toddler, which findings should you report to the provider? Which isn't right. Again, it's the head and the chest. Everything else is normal. Okay. Everything else is normal. The head should not be bigger than the chest. At minimum, equal to, but usually the chest is bigger by this age. And if not, why is the head still big? Is there hydrocephalus? Is there a brain tumor? What's happening? Multi-select. What are the risk factors for SIDS? So we know males are more than females. Low APGAR scores at birth shows you maybe some hypoxic episode at birth, and of course smoke, and breastfeeding helps prevent SIDS. Been proven over and over again. Leland's back on fire. What are the common fears of a preschooler? Ages 3 to 5. You know, I could put in there ghosts, mutilation. So that's why you have Band-Aids. They, you know, don't like to be alone and abandoned. That's part of it. And of course, your ghosts and animals also are part of those fears. Good. Which concept reinforces the development of sense of trust for an infant? They know what's coming and their needs are met, and that's their sense of trust. They know when they cry, somebody's going to come for them. So that's the most important thing. The nutritional hygiene needs are met. That's part of it, but they know that when they call, no matter what, somebody's coming for them. What does a rooting reflex enable the infant to do? Remember, rooting is when you choke, you know, take and stroke the cheek, and it's because they're going to be fed. Good job. A multi-select. A child's been admitted with profuse diarrhea for 2 days. What would you expect? Now, I'll warn you, I'm going to be giving you acid-based questions in many of these different Kahoots. I believe there was 3 questions on acid base on the HESI, and they're on the NCLEX now. So understanding them are extremely important. So we know that if you're losing fluid anywhere, you always worry about potassium, and it's metabolic alkalosis because the amount of, you know, acid that's going away. So what does your body do? It becomes more alkalotic. So please follow your acid base because you're going to need that understanding. A multi-select. An infant's unable to take breast or bottle and has an oral gastric tube. What's important to remember? Baby can't eat normally, can't suck, you know, drink, can't suck, swallow, and breathe. So we have to feed this child, usually a premature child or, you know, a full term that has other issues. Now, whenever you have an OG tube, you always need to check the placement. This is a clean procedure. It is not sterile, okay? Everything in the mouth is a dirty mouth to begin with. Pacifier is so important. And you don't want to put anything in the mouth because they can choke. There's reasons why they're not getting anything by their mouth. A little bit could choke, they're not able to swallow, or maybe they have some sort of anatomical something going on. So no, you don't do that. I know it would be nice to do it, but no, we don't, for many other reasons. What does an infant start to do at 3 months? So if you remember that gross motor sequential trends that go on, lift head starts rolling. So yes, and it's front to back, it starts with. What does an infant start to do at 9 months? Again, look at that gross motor. What do they do? And when do you think it should start? And that's basically when they're walking or cruising or on the side of a coffee table or a couch. You should be able to pull themselves up at this point. Mackenzie, you're doing it, girl. Last question. An infant's first form of communication is? And absolutely crying, because that's how they communicate to get their needs met, and cooing because, you know, they see the parents, oh, aren't they so cute? It's the way they talk when they're happy. I love a cooing infant. Let's see how we do. Number 3, Terry. Good job, Terry. Number 2, whoever MW is. Yoop. Number 1, Mackenzie. Yoop, yoop. My niece Mackenzie just had a baby boy. Nat, number 4, and Leland was 5. Good job, guys. Okay, let me get out of here. And get out of there. And stop here. I want you all to fill out your attendance attestations. You have attended a class. Make sure that's done so you have your point of reference for your Canvas so that you're not thrown out of the course from non-attendance. Any questions for anybody? Anything I can help you with? You'll be getting the recordings tomorrow. You'll be getting the regular recordings and the YouTube channel that you can go to. You also are going to be getting the dosage calc with the handouts I've sent you. So you will be getting all of that stuff. So that will be coming. Anything else? Have a good day, guys. Thank you so much. Appreciate y'all.
Thank you.
Thank
You're
you.
always
Have a
welcome.
good one. Be safe,
too.
everyone.
Yeah, please be safe.